Hello friends, let's see the cutaneous nerves of the upper limb. In the previous part of this lecture, we have already learned the superficial veins as well as the lymphatics, and along with that we also learned in detail of the axillary lymph nodes. For the cutaneous nerves of the upper limb, we can divide the parts of the upper limb into different regions, and then we can see the nerves which are going to supply that particular region. And for that, we divide the upper limb and the nearby area of the upper limb into 9 regions. So for the understanding of the cutaneous nerves of the upper limb, here we can see the figure on the left side, we are going to draw the different regions, and the figure on the right side, we are going to draw the nerves which are going to supply that particular region. Here in this figure, we can see this is the anterior aspect of the upper limb, and this one is the posterior aspect of the upper limb. Here in this anterior aspect of the upper limb, we can see this area, it is of the pectoral region. Here there is the shoulder region. On the dorsal aspect, here this area is the scapular region, and this scapular region, it is not part of the upper limb, but it is nearly concerned with the upper limb, same like that of the pectoral region. Here this is the front of the arm, and this is the back of the arm, front of the forearm as well as the back of the forearm, cutaneous nerve supplying the palm as well as the cutaneous nerve supplying the dorsum of the hand. Now let's see the cutaneous nerves which are going to supply all these regions. When we see the pectoral region, this pectoral region, it is going to be supplied by the cutaneous branches from the medial supraclavicular nerve as well as the intermediate supraclavicular nerve, and these two are the branches of the cervical plexus along with one lateral suprascapular nerve also, and this lateral suprascapular nerve, it is going to supply the shoulder region. Along with these two suprascapular nerves, this pectoral region, it is also going to be supplied by the anterior cutaneous branches of the upper 6 intercostal nerves as well as the lateral cutaneous branches from the 3rd to 6th intercostal nerves. When we see the shoulder region, this shoulder region, it is going to be supplied by this lateral suprascapular nerve. Along with that, it is also going to be supplied by the branch of the axillary nerve, which is going to supply the upper and lateral aspect of the arm, and that is the upper lateral cutaneous branch of the axillary nerve. When we see this scapular region, it is going to be supplied by dorsal rami of the lower cervical and upper thoracic nerves in craniocaudal sequences. As we already discussed, the scapular region, it is not the part of the upper limb, and that's why the scapular region, it is going to be supplied by dorsal rami when the cutaneous nerve supply is concerned, but the muscles of the scapular region, they are connected with the upper limb, and that's why this musculature of this scapular region, they are not going to be supplied by the dorsal rami, they are always going to be supplied by the ventral rami from the brachial plexus. When we see the cutaneous supply of the front of the arm, it is going to be supplied by one important nerve, and that is the intercosto-brachial nerve in its upper and medial aspect, and this is the undivided lateral branch of the second intercostal nerve. While it is also going to be supplied by the medial cutaneous nerve of the arm as well as the axillary nerve, which provide the upper lateral branch of the arm. Along with this cutaneous nerves, the front of the arm, it is also going to be supplied by the lower lateral cutaneous branch, which is actually the branch of the radial nerve. This medial cutaneous branch of the arm, it is the branch of the brachial plexus from the medial cord. When we see the back of the arm, it is mainly supplied by the posterior cutaneous nerve of the arm, and which is the branch of the radial nerve from the axilla. Along with this posterior aspect of the arm, it is also going to be supplied by the posterior cutaneous nerve of the forearm, which is actually given off in the arm and going to supply the back of the forearm, which is also a branch of the radial nerve. Along with these two nerves, this back of the arm, it is also going to be supplied by the nerves from the front of the arm. Now the front of the forearm, it is going to be supplied by the median cutaneous nerve of the forearm, which is actually the branch of the brachial plexus from the medial cord. Along with this medial cutaneous nerve of the forearm, the front of the forearm, it is going to be supplied by the lateral cutaneous nerve of the forearm, and this lateral cutaneous nerve of the forearm, it is the direct continuation of the musculocutaneous nerve. When we see the back of the forearm, the cutaneous supply of this back of the forearm, it is mainly supplied by the posterior cutaneous nerve of the forearm, which is actually the branch of the radial nerve, and it is also assisted by the medial cutaneous nerve of the forearm as well as the lateral cutaneous nerve of the forearm, which are going to supply the anterior aspect of the forearm. When we see the area around the wrist and the palm, this area, it is going to be supplied by the Palmar cutaneous branch of the median nerve and the Palmar cutaneous branch of the ulnar nerve. And these Palmar cutaneous branches, they are also going to supply the front of the forearm. Now let's see the cutaneous nerve supply of the palm as well as the dorsum of the hand. In the palm, the medial 1.5 finger along with the ulnar side of the palm, it is going to be supplied by the superficial branch of the ulnar nerve. And the superficial branch of the ulnar nerve, it is also going to supply the dorsal aspect of the medial 1.5 finger up to its middle phalanx, while the lateral aspect of the palm as well as the lateral 3.5 fingers, they are going to be supplied by the median nerve, and this median nerve, it is also going to supply the dorsal aspect of the lateral 3.5 finger up to its middle phalanx. And in the thumb, it is going to supply the skin over the dorsum of the distal phalanx, while the proximal phalanx of the medial 1.5 digits of the dorsum of the hand as well as the ulnar side of the dorsum of the hand, both are going to be supplied by the dorsal branch of the ulnar nerve, while the distal phalanx of the lateral 2.5 finger as well as the distal phalanx of the thumb. So we can say distal phalanx of the 3.5 finger on the lateral side along with the dorsum of the hand on the lateral side, it is going to be supplied by the superficial branch of the radial nerve. So we can say this ring finger, it is going to be supplied by the all three major nerves of the upper limb. These are the ulnar nerve, median nerve as well as the radial nerve.